Yeah, so thank you so much for giving me the opportunity to do a very short talk on how health might respond to young people who've been sexually abused. I work at the Bridge Sexual Assault Referral Centre in Bristol, and we see young people who've been acutely sexually assaulted, but also we have a service for young people who have reported non-recent sexual abuse, which is relatively new. So I'll talk a little bit about that as well. We did have somebody from the CSA Centre for Expertise yesterday with this slide up, but for the whole country. So the 500,000 number is the estimate of children who are sexually abused every year, and that's epidemiological data. And what I've done is I've had a look at their data hub and pulled the numbers for Somerset, because this is Somerset Safeguarding Partnership, Children Partnership talk. So just looking at those numbers, based on the local data, about 5,000 in Somerset estimated to be sexually abused every year. Big county, but relatively small population. And as we go up towards the tip of the iceberg, you can see a similar pattern to yesterday, where the numbers of children who then come to the notice of agencies, and that might be the police or it might be social services or health, just gradually diminishes until we've got a really, really tiny number who are actually officially protected by a child protection plan under the category of sexual abuse. I did manage to pull separate police figures, and we've got 700 here reported sexual abuse. That's not online, that's non-online sexual abuse in the same year. And then I looked at how many children accessed healthcare through us, and it was 50. So I think that just gives you an idea about how few children seem to be able to access healthcare. So why should they be accessing healthcare? And if they do, how can we respond to their needs? So starting with a trauma-informed approach, which has really been outlined by the Greenhouse in the previous talk. Belief and compassion, very, very important right up front. Children and young people have a right to be heard when they report sexual abuse. And we also know from research that they do want to be listened to. They want to be able to tell. So it's about giving them the opportunity to do that. There are lots of quality standards nationally around how health should respond and consider all the health needs for children and young people who've been victims of sexual harm. And so any service that is providing healthcare should really look at those standards and make sure that they are providing high quality healthcare. The Royal College of Paediatrics and Child Health and NHS England have produced some really, really good tools for that. Then thinking about access, I think this is one of the biggest issues. We really need to break down the barriers for access for children and young people after they have reported sexual harm. This really involves moving away from a perception of the medical assessment or medical examination, as we sometimes call it, as harmful, painful, and traumatizing, and moving towards the idea that it can be a therapeutic process in itself, and to think about the wider benefits of that assessment. What we tend to find is that lots of children are not referred because of professionals' concerns about causing harm through the examination process, or even beliefs that the examination is not necessary, and therefore effectively closing that opportunity off for children and young people. I think that particularly happens where there's a belief that there's no evidence for prosecution and no forensic evidence which can be obtained in the children who have reported non-recent abuse. So once we have allowed a child or young person to access the health offer through a referral, then we need to make sure that we prepare them adequately for the assessment. What we know from studies is that actually the anxiety and fear that most children exhibit around these assessments is completely in line with any other kind of medical examination. And also that as the examination proceeds, their anxiety and fear does reduce. So their experience depends on how much information and advice they get ahead of the assessment, so that we can prepare them well for it. And also how supportive and sensitive the actual practitioners who are doing the assessment are. At the Bridge, this is commonly done with a doctor and a crisis worker who is trained to pick up on all of those worries and anxieties throughout the process that a child may be experiencing, and to check in regularly to ensure that they are supported throughout the process. We also need to make sure we involve carers, and but at the same time ensure that young people, particularly teenagers, have an opportunity to have their health needs assessed without a carer present if that's what they want. So the experience that they will have through the assessment and after will actually determine potentially their path to recovery. It could be the first time that that child has had all of their needs considered in a non-judgmental setting. And significantly, again from research, most children report that the medical examination is a positive experience when they reflect on it, and that they feel better afterwards. So I want to do a little bit of myth busting here. What is an FME, Forensic Medical Examination, or CSA Medical, and what is it not? So the benefits of doing an examination, well, we potentially might find some evidence, and in an acute case, that could be forensic evidence, or it could be injury documentation. And we can pick up injuries in non-recent cases, even years and years after the abuse has happened. But actually, in the great majority of cases, examinations are normal, and we have to remember that and reinforce with the young person that doesn't mean that the abuse has not happened, and it doesn't mean that we don't believe them. During the process, we might identify other types of abuse which need to be addressed, and we often identify unmet health needs. So there was a piece of research done around 5 years ago looking at 250 children who had medical assessments, and what was found was around 57% of these had a medical concern which was related to the actual referral reason, which needed addressing. 31% had an unrelated medical concern which had not been addressed. 22% had an emotional or behavioural concern which required onward referral, and around 7% had some physical signs supportive of sexual abuse. So I think those figures really give you an idea about the value of doing health assessments. We have to remember that the intimate examination is only a very small part of the assessment, and we ensure that young people are very well prepared for that part, and also they don't have to have it done if they don't want to have that part done. It's often a reassurance exam. So as I said, many are normal, and young people often actually are very relieved when they can be reassured that that part of their body is healthy and normal, and they can move forward with that. And we can see young people over the age of 13 without the police. It doesn't have to be related to a court process. So what is the medical not? Well, as I've already said, it is not compulsory. The young person can say no to the whole thing, or they can say no to parts of it. And throughout, we offer choice and control over what happens. And if they're not ready at that particular point in time, we will offer them an appointment when they are ready. It doesn't have to be intrusive or traumatic, and that's language that I really, really want professionals to move away from when they're thinking about the health offer for young people who've experienced sexual harm, as it's not always an internal examination, and many occasions it's just looking from the outside. We make sure it's not harmful or painful. That would be a failure in our duty if that was the outcome. And we make sure that the child has the right support with them. So it may be a parent, or it may be somebody else they want there. It's not always proof of sexual assault, and we need to be clear about that and honest. And we do not offer virginity testing. which is something which is occasionally asked for in certain communities. So the medical really is a holistic assessment of all the child's needs at a time when they are vulnerable. So what do we offer in the medicals? Well, this is just a pictorial idea of the kinds of options. And as I said before, the child or young person chooses what they want to have from this. So we do not tell them what they have to have. The stethoscope represents the examination of the body. The tape measure represents identification of injuries and potentially documentation of those. The swab can represent forensic swabs or other swabs for things like sexual health testing. And we use urines to do that as well. The medicine there represents contraception, which we can use in the acute setting, but we can also talk about contraceptive methods in the non-recent setting as well. And we can give vaccines such as hepatitis B. The piece of equipment, the camera in the middle, is something we call a cobscope, and we use that to capture pictures of the genital area, and that's specifically for court cases and medical evidence. So that's not something that the general population are ever going to see. It's something that professionals will use to form an opinion on what may have happened to the young person. And then finally, that brain there is really to go back to the talk we've just had from the greenhouse around the psychological offer, which I think is probably one of the most significant elements of support. We will get young people coming to see us who are in acute mental health crisis, and we need to make sure that we appropriately address that for them at the time. So this is the way that we try and deliver our service. We want young people to feel safe in that space and at that time. So we provide a calm environment and the right people to support them. We're very open and honest with them about what we can do and about what we can't do. And in particular, I'm thinking of safeguarding referrals. So we're very clear with young people that we will have to contact children's social care if they come into our services. And that's to ensure that they remain safe. I've talked already about choice and control throughout the process, and it's important that we do that for the small things as well as the big things. We think about the cultural and contextual situation for the young people that we see, and we try to make the whole process non-traumatic. So that's no repeat questioning. We do a lot of information gathering ahead of our assessments, and we try to develop a shared language with that young person in a short period of time. This allows them to be heard, and they take it at their own pace. So if we need to take a bit longer, then that's what we do. And we make sure that we are judgment free. And that's a comment actually we get back a lot from young people, is that they feel that they have not been judged during our assessments. It's so important. We ensure that all the support that they need and that they want are around them and are available in the moment for the assessment. So this term, nothing about me without me, seems like potentially a bit of a platitude, but I genuinely think that we embody that at the Bridge in the services that we provide. So this is the health pathway for sexual assault and sexual abuse in Somerset. I just thought it'd be really helpful, as there is probably a significant local audience, for you to see this, and it will be available afterwards for you to refer back to. I've tried to simplify it as much as possible. So you can call the Bridge number, which is that number at the top, 24/7, and speak to a paediatrician for advice in all cases of sexual assault which have occurred less than 7 days ago. And you can call for advice on non-recent cases as well on that line. It will always be manned by somebody who you can talk to. If you have a strategy meeting which involves a decision around sexual harm, then we really want to be invited to those, and that's the email address that you can send the invite to, so that we can be involved and make sure that you're given the right advice around health support for that young person. If it comes to making a referral for our services, the form is on our website. We got a new form specially for children and young people, which asks for a bit more information so that we can really target the services and make sure that we know enough about that young person to respond. Once we've received the referral, we will contact you, and we will then contact the carer or young person directly to talk them through the process and to support them in making the decision about whether they're going to come and access our services. And if you want to contact our dedicated team for non-recent sexual abuse, which is 8 days or more, then we have a new webpage on our website for the Avon River Clinic, which has all the resources that you will need there to access our services.